What is going to help you about pain is a relaxation. What happens, the body's way of handling an inflammation or a trauma is called splinting. If you have a broken bone, what do? You put a splint. So body does it automatically. So you have a inflammation of the knee joint, or if a torn cartilage, the ligament tightens up. So to learn how to relax. And how to relax, we'll show you how to relax. You sit down in a pose, especially for a knee, what do? You sit down in a pose where you get pain. If you get, oh, I cannot do it, it hurts, do it a little less. But stay. So if you can stay here, stay here. Close your eyes, bring the relaxation. Spine straight, eyes closed, Pranayam Mudra. Breathing, slowly and slowly you will see this knee is going to get relaxed to the point you will feel it here. There are two ligaments called the medial and lateral ligaments. You'll see there is a space between them. You'll feel it softer. You'll feel this thing is going in. If you see that, it'll be tight. When you have a ligament like this, doesn't matter what happens to your knee, you're not going to have a pain. My left knee is all swollen. My left knee is all 1.5 times the size. I don't get any pain because I practice it every day with the breathing. So pain is due to the tightness. So learn, relax, chronic pain will go away. Second, pain is due to lactic acid. Lactic acid is due to called anaerobic glycolysis. I have a sugar. The end product of metabolism is glucose. Glucose burns with oxygen, form carbon dioxide, water, and ATP. If there is not enough oxygen, called anaerobic glycolysis, it produces lactic acid, pyruvic acid, pain-producing substances. By able to breathe properly, able to blow out the carbon dioxide, bring the oxygen back in, if you create an aerobic glycolysis, you don't have any pain. Example is, today you go and run first time. What happens? Tomorrow you develop pain on your muscles. Because what you have done when you're breathing, you have been running, holding your breath. If you run very slow speed when you start with a completely effortless breath, breathing out longer than breathing in, you are not going to develop the pain. For all of you who do that, who does a aerobic exercise, you slow down now. If you're running a treadmill, if you're running a 4 miles, come to a 2.5, 3 miles. Follow your breath. Slowly you'll be able to go back to the same level with the breath. So chronic pain, primary pranayam is the alternate nostril breathing. Anulom Vilom pranayam and a Brahmri pranayam, which we'll practice now. Those are for pain. TMJ is a tightest, most powerful tool for TMJ is Brahmri pranayam and alternate nostril breathing. Then when you became a little bit of more used to it, relaxation of the head and neck space area, that comes with the difficult asanas, like a shoulder stand, plow, and a headstand. When you're able to do a headstand, completely effortlessly relaxed, temporomandibular joint pain goes away. And the same concept is a neck pain, all the pain in the upper part will go away when you are able to do a plow, shoulder stand, or a headstand. And again, you'll push for it, it'll come to you, and you'll see that this thing is getting better. The gastric fire is called an Agni. Agni is the one I need to increase my gastric fire. I cannot physically sit down in a Vajrasana. Vajrasana is sitting on a hill. If you know, it's a Kapalbhati Pranayama. Breathing exercise, we'll do it now. This is called Agni Pradhan Pranayama. It ignites the gastric fire. It's called Jathar Agni. So Kapalbhati Pranayama will be your increasing gastric fire. What about getting certification from Taksha University? Taksha University will give you a certificate which you hold it for your continuation of your training. At this point, from the International Association of Yoga Therapists, standard is being created. The accreditation is in the process. There is no standardization of yoga therapy at this time. For the people like you who have been a senior practitioner, what I will request you to have all the informations you have, hold on to it and submit at a point to be a grandfather. Because grandfathering is going to come and the new standardization accreditation process probably will be applicable for the people who are coming in to the system. So at the present time, hold on to the certificates. Taksha University will give you all the certification, but that certification will be used for your future. At this time, we have 102 schools called yoga therapy schools in our list. We have 50 countries on the list, about 4,000 members. These are all very high-level yoga practitioners. So, I have TMJ, bulging of the disc, bone spurs, C4, C5, what to do more of the more and less and everything. Okay, always remember what the last Abba just said. This is body. And in yogic term, this is the hardware. Okay, and the software is here. Software is the mind. When you fix the software, hardware gets fixed. Interesting about all the cervical disc, herniated disc, spinal stenosis, cervical stenosis, all these are structural issue. But remember one thing, this is a condition which is make your life miserable. It's not going to kill you. This is not like a cancer or a heart attack or a stroke, making your life miserable. Only miserable is your pain. Obviously, there is some nervous, deficiency which you come, we'll talk about it. The way to do it is to relax. And primary way to relax is, especially for cervical disc, you turn your neck to the point where it hurts. Suppose if you come here, it hurts, you come a little short of that it's not hurting. Close your eyes, you do the breathing out longer than breathing in, or alternate nostril breathing in that pose. Even you do a mudra, called a dhyana mudra in one hand. If my neck hurts, I bring my neck to the point where I get pain, and I just back up a little bit, close my eyes, I do the dhyana mudra, I do alternate nostril breathing. Very gently, which we'll be doing now. That will be your treatment. But basically what it is, you need to do a daily practice. Once you daily practice, you will see the two things will happen to you. All the aches and pains will go away. And people like us, mature people, we don't get older, we get mature. Mature people, we have two problems. First is a chronic pain. Wake up in the morning, oh my God, cannot turn, cannot move, hurts. Second is a balance. You lose your balance, you'll see all the person, what they're doing, they're walking like this, walking like this, walking, holding to this. One good way to overcome it for you to do is at home, walk barefooted. Take your socks off, slippers off, walk bare. More and more you are in contact with the ground. Better and better is your sensation in your feet. It's called peripheral neuropathy, which sets in. Second, practice on standing on one foot. The more and more you practice balancing poses, better and better balances it will come. Second, you will do, if you can close your eyes and do it, which almost became impossible initially, but if you can do it, it quiets down your mind enough to the point it brings your balance back and the pain goes away. And regarding pain, one of my neurologist friend told his patient, when you wake up in the morning and have pain, you thank God you are still alive. Most of the dead people don't feel pain, Okay, the reason yogis can walk in a fire, yogis can walk on a nail bed, they can lay down in the nail bed, and maybe 20 years back I won't believe it. Now I believe it because I've seen it. I've seen all of them. Just last year, I went to India, put a fire here, you know, and they just walked on the fire. So no problem. They lay down in the nail bed. It is basically, they learn how to control their autonomic nervous system. There are 3 nervous systems we have. The first nervous system is voluntary nervous system. I'm going to grab it. I'm going to let my brain do it. Second is your involuntary nervous system. I look at the food, my stomach acid starts secreting. Then I have an autonomic nervous system. Even if I do anything, my breathing continues. Even do anything, my heart continues. There is yogi came here in 1969, Swami Rama. He'd been hooked up with all the leads and everything. And he literally could stop his heart. When he could stop his heart, they could see that he has some atrial fibrillation. How they do it? They practice a thing called the Bandhas, Krias, Mudras. The Krias are the most important. By the Krias, they have 6 Krias they do. By the 6 Krias, they literally control their physical body to the point that they control the autonomic nervous system. The bandhas are also, as Dr. Chakraborty is showing, the diaphragms, what you do. These are, again, in yogic and Ayurvedic term, there's a lot of terminology being used here, but bandhas, we talk about your chakras. We talk about 3 bodies, 5 layers, 7 chakras, controls, but it has some physical function. The first one is your Jalandhar Bandh, we call it chin lock. When you're able to put your chin down to chest, as Dr. Chakraborty, there's a diaphragm stops, it also has a lot of other function. There's one called a carotid sinus. It slows down your heart, controls over your autonomic nervous system. This is called Uddiyani Bandh, abdominal lock. You breathe out first, to take a deep breath in, breathe out, suck your stomach and hold. And as long as you hold, it increases the negative intra-abdominal pressure. It pushes pressure on the diaphragm, it adjusts your autonomic nervous system. The most important thing happens for the yogis is they're able to shift from sympathetic to parasympathetic very rapidly. What happens, if you get a stress, fight and flight response, so a car is coming towards me, I'm run. How do I run? My blood pressure goes up, heart rate goes up, my respiratory rate goes up, I run is sympathetic response. Same way for the yogis when they have to walk on this fire, the parasympathetic activation takes place right away. And this is the control, they've been doing it for years and years. And Mula Bandh is a pelvic lock, you contract the whole pelvic floor, also called a Ashini Mudra. You pull it up, you contract the pelvis, and we do it, and we'll be practicing here soon. When you do all 3 together, it's called a Mahabandh or a Great Lock. This is your abdominal lock. You will pull your stomach in, and you'll hold it. There's a chin lock, and this is your Great Lock. You do the abdominal lock, chin lock, and the pelvic lock all at the same time. And we'll be practicing here very, very soon, all these 3 locks. Mudras, what happens is it called a neurophysical connector for the flow of prana to the organ of healing. As you heard Dr. Chakraborty saying that this is your observation. The rishis have been observing for thousands and thousands of years, and it became a science. What is science? Experiment, observation, inference. That is science. So they've been observing for thousands and thousands of years. It became science. Our universe is made of 5 elements. First there was a space. The space came air. Air had a friction, caused fire. Fire melted the cloud to form the water. Water froze into earth. Space, air, fire, water, earth. All the components of the body, well, all the components are also present in our fingers. The space is a large finger, middle finger. Air is your index finger. Fire is your thumb. Water is your little finger. Earth is your little finger. Based on the elements, if you understand, especially the yoga therapy, you have to understand what is called Ayurveda. Ayurveda, how many people know about Ayurveda here? Very good. We have a lot of people doing Ayurveda. Ayurveda, you will understand that these components, the 5 elements, creates the 3 body types called Vata, Pitta and Kapha. And all the disease, you will see how it balances. Mudras are so famous. This is your New Delhi airport. If you go to India, in arrival terminal, the moment you arrive in India, the capital of India, you walk in, first thing they greet you with the mudras. There are all the mudras lined up, and actually this is your immigration and passport check-in. The moment you check in the top you have all the mudras lined up. And other interesting thing is in Delhi airport, when you leave departure terminal, there is a sun salutation. And sun salutation, it says, first it says, knee replacement for whole life. Sun salutation at 70. And it's very nice. I have some slides made. I'll show you to some other time. So, what happens in the mudras, I'll give it to all of you. When you touch your fire element and the air element, it quiets down your mind. It's called a Dhyana Mudra. It is primarily used for quieting down your mind. If you bend your index finger down and put your thumb in the top, this is called a Vayu Mudra. Vayu Mudra, controlling the Vata, it controls the Vata-related disorders. All the musculoskeletal disorder and neuropsychiatric disorders. You do this mudra. This is called a Shunya Mudra. This is the space in the fire. Space is all connected to your hearing. So it improves your hearing. We have a very interesting fellow, his name is John. I just had a lunch with him yesterday. Yesterday. So he wears a hearing aid. So one day he came, so he was doing like this to me. I said, what happened? He said, I'm not wearing my hearing aid, you know? So this is my hearing aid. Great. So this was his hearing aid. This is called a Prithvi Mudra. You have a earth element and a fire element touching. And it is for to control the kapha-related disorders, primarily diabetes and obesity. And how we do it, we'll be practicing it when you do the pranayam. I just want to showing it to you. When you push your ring finger down to thumb in the top, this is called a Surya Mudra. This is to increase heating. It's a digesting mudra. This is used for high cholesterol. When you get a high cholesterol, we do the mudras like this. This is called your Varun Mudra. You touch your water element and the fire element. It controls your bladder, kidneys, but mostly the bladder. If you cannot go, if you're in a plane, if you're in a board meeting, if you have to go, just press your pinky. And kids do it all the time. If you look at the children, they will do, cannot go do number 1, press your pinky, press your pinky. It's a very important concept. The children do it all the time. And most of the mudras are experiential. If you keep on doing it, I've seen so many yoga practitioners. The moment they do it, they keep on doing it. Initially, they have no idea they've been doing it. They keep on doing it almost, unknowingly. This is called a Shakti Mudra. This is strength. You put your water, earth, and a fire element together. This improves your strength in the body, called Shakti Mudra. This is called Apana Mudra, downward called Panchan Mudra. It is your space, water, earth, and the fire. It digests all the excess in your body. Digest your excess sugar, excess fat, anything excess you can think about, digest. And if you just bend your index finger down, This is called Apana Vayu Mudra. This is called also Hridaya Mudra. This is for the heart. In fact, we have just one person, she just told me she was one of the first president of the Yoga Alliance, Hansa Knox. So her father was in the CCU with a maybe chest, but one of the cardiac ailment. So her father was on the monitor, and she was asking him to do this mudras. He was doing the mudras, it was changing the EKG pattern. And then the nurses were asking her, what you're doing? She says, I was testing these mudras on my father. It's called a Linga Mudra. This increases the heat. You'll see the children, they do it all the time. This is to increase the heat. This is called a phlegma. That's what I say. You don't feel any heat here, cold, nothing, because the yogi has been doing it for years and years. The mudra, when you touch, this is also another name called a chin mudra. It opens the lower part of the lung. If you close the hands like this is called a chinmay mudra. It opens the middle part of the lung. And the one we do called a adhi mudra, the yogic fist, thumb in the inside. This improves the upper part of the lung. This is the thing what yogis do, what yogis prepare their body to control their autonomic nervous system. And they've been doing for years and years. After lunch, you don't want to see it, but if you want to see it, I'm going to show you only one. I'm going to show you a little bit of neti part, so to see. The first one is called neti. The concern about yogis is, you wake up in the morning, you wash your face, you brush your teeth, you do everything, but you don't wash the most important organ. This is your nose. That's where you're breathing. That's where all the oxygen is going, prana is going. The moment you start doing it, the neti part, first is the fear. When you overcome the fear, you're able to do it, and it's very private. You blow your nose, then look at it, it says, oh my God, I've been living with this all my life. Then when you go to India, somebody just came back from India. Fish is here. Who is she? Yeah, she's there. She just came back from India. When you go to India and do a neti part, you will see what comes out, Because it doesn't matter in India. It's any of the polluted city. Go to Mexico City, probably the same thing will happen. Dhauti is a stomach cleansing. Yogis know how to clean their stomach. You said you wash your body, take a shower. What's wrong with the stomach? So what they will do, they will drink a glass of water, they'll keep on drinking until they feel a little feel of sensation of fullness. Then it takes a long time, this is all in relaxation. They'll stand up like this, they'll touch their soft palate, and all the water comes out. And water will come out not as a vomiting or not as a retching. It comes out exactly like a flow of water, relaxed water. In fact, it's called a kunjal kriya. Kunjal is the name of an elephant. When the elephant water comes out, it's called a kunjal kriya. This is called your dhauti. Then they also do what they call the cloth. They will swallow a piece of cloth. The cloth will go down to the stomach, then slowly pull it out. You have to wash the stomach with a cloth called vastra dhauti. Then it's called a danda dhauti. They will fill up all the stomach with the water, and they will put a little bit of a rubber tubing through there. But what happens to them, they don't even know it is going there. Have you seen the sword swallower? The people who swallow the sword, they show it in the circus. This is nothing but relaxation. They're so relaxed enough, the sword goes through the esophagus all the way down to the stomach, then they pull it out. The moment you're tight, you won't be able to do it. And that's how yogi develops it. Basti is an enema. We use all the enemas here, put a little bit of enema to clear the colon. Yoga believes your health is defined as a straight spine and empty colon. Yogic tradition or Ayurvedic tradition, you get up in the morning, drink a glass of water. The moment you drink a glass of water, your gastrocolic reflex starts in. The moment your gastrocolic, within a short time, you'll see a bowel movement, first thing in the morning. It will happen to you, practice, and you'll feel good throughout the whole day. Yogis doesn't need that. They have a voluntary control over their anal sphincter. It is called Ashini Mudra. They can relax enough, they can suck the water in on their own, and they can clean it up on their own. It is a very unique technique and is possible. Tratak is the vision. You look at a spot, and then it's called a Jyoti Tratak. You look at a flame, and then they look at without blinking. So blinking is both the voluntary and involuntary. What happened? The voluntary is a conscious, involuntary unconscious. By their practice, they look over, they take over the voluntary function. Kapalbhati is a pranayama if it is done at a slow speed. If a Kapalbhati done in a higher speed, it becomes a Kriya. And Nauli is the one which is isolating the rectus muscle and moving and massaging all the organs. This is a neti pot. You can carry by it anywhere now. Everybody has a neti pot now. These are porcelain. They're very nice. You put a little bit of water, little salt, put through one nose, it comes through another nose, blow it. Put through another nose, come other nose, blow it. Takes a minute. The two things will really change your life if you start from today. In the morning, brush your teeth, scrape your tongue. Tongue scraping and neti pot in the morning. Slowly and slowly you transform. You'll see the transformation takes place within you. Plastic ones are good for your travel. When I'm traveling, I always have a bag with my salt and with my, it always stays with me. And I never miss the gel neti in my life. Doesn't matter where I am, I always do it. The salt is very tricky because it's whitish. When you travel, TSA will throw it away. It looks like something addictive substance, I told them one time, I want you to test it, don't even test it. This is, it looks like drugs, so they'll throw it away. So be careful on that. This is the way you do it. You put in the one nostril, it easily comes out. If you want to see it, even after that, I didn't know. Even if you don't want to see it, I will show it to you. Okay? Because I want to see that how easy it is for you for you to get out of the fear. Is another one. You see how the nice flow of water comes out of the nose? This is, you don't want to see it. I was in Trinidad. This is called a Sutraneti. Sutraneti is after water, when you get a gel neti clean, they put a little bit of actually a red rubber catheter through one of the nostril, comes out the nostril, they literally floss the nostril. And tell me why. They literally control all the reflexes. The nose, what happens? Anything goes in the nose, you sneeze, cough out. So the moment by the time that they do it, they can control all the reflexes, they can control their physical body. That's the way they walk on this. This guy comes up to me, he said, I can do it. I said, okay, let's do it. And very nicely, You can do. This is the dhoti. Dhoti, again, if you see that water will come out as if like a, it's called a kunjal kriya. Comes out like a water from there. This is one of the things, we do a teaching together. Somebody wanted to see. He said, okay, we'll show it to you, but first thing in the morning. You do it in the empty stomach. You don't do now because you want to be sure. And you will see what comes out. And then again, Sankha Praksala, clinic. The yogis will drink 2 glasses of water, they will 5 asanas. It's there, and I already gave it to you. 5 asanas, you'll start having a bowel movement. To the point now colonoscopies are using it. So colonoscopy is such a simple procedure, but the preparation, it really kills you. You stay up all night, you cannot do anything, but because you'll be going in and out. But here, you go there, you drink the water, within a short time, you'll start having a bowel movement. This is Tratak, called a Jyoti Tratak. You look at a flame without blinking. And as long as you can, even the water starts to come out. This is Noli. And this takes a little time to learn, but once you learn Noli, you will. So before you start pranayam, this is the basic requirement of a pranayam, is jal dete. Unless you clean your nose, you're not able to breathe through your nose. Yoga does not allow you to breathe through your mouth. You all breathe through your nose, breathing in and out. Because nose is it filters the air, it humidifies the air. It's like your personal air conditioner. If the air is warm, it pulls it down. If it is cold, it will warm it up. It will direct the air to the lung. If you breathe through the mouth, it goes into your stomach, it not goes in the lung. If you at all have to breathe through your mouth, you breathe through your nose, breathe out through your mouth. It's a lot more physiological. So before you start doing a pranayama, which we'll do it now, what we'll do, these are the DVDs. If you're interested to all about this, which I'll give it to you, these are all the 3 DVDs you can order online. One is your introduction, one is an asanas and pranayamas. And let's see how simple it is. If you want to see, you can. If you don't want to see, you can step out of this room. You say, be my guest, it'll be fine. But once you see it, you'll be able to do it at home. And Abha said, another way, our another guru is, other than Google, is called YouTube. Anything you want to do, go to YouTube. You'll find it. How many Netipad is there in YouTube? I think hundreds of them Netipad. I tell you what you have in YouTube. In Netipad, this fellow is doing, oh, I feel so great. How? I cannot feel so better, I'm breathing. You know, there is some coffee here. Let me try with the coffee, you know. He puts the coffee in the Netipad. He's doing with the coffee. He said, wow, I feel great. You know, I have another idea to do. Let me do it. Gets a whole bottle of scotch, you know. He put the scotch in Netipad in the scotch. So only YouTube. Okay, I generally carry a plastic one when I'm carrying it, but it's fine to do it. And carry little salt, TSA approved bottle, so TSA wouldn't bother me. It is your unanodized salt. In the market these days, all the ENT people have marketed called the Sinucleanse. What they do, they take the salt, they put a little bit of sodium bicarb, you know, sodium bicarbonate to neutralize the pH. But really, it doesn't matter. Initially, you need all this stuff. In a short time, you really don't need anything. You can do without any salt, without any. You put the water. If you like to have a little bit of lukewarm water, is good. Fill it up. I put some water here for a while, and you will see. Can all of you see from the back? If you want to come in front, be my guest, you can come in front, take a look. Because really what I want you to get rid of the fear. The fear you have, a lot of people tells me I cannot do it because I'm so afraid. Water will go to my head. Then there is a incidence of 2 meningitis from the water going to the brain. So what I told the person, the pleasure of living is worth the fear of death. The fear of the... Wow, I took a deep breath in. You take a salt, you put it about, if you had initially put about 4 or 5 pinch. How many pinch? Everybody asks, how many pinch? To just stir it a little bit. If you see it from the back, see how easy it is. You put it in the one nose, and you breathe through your mouth, turn your nose to the other side, and see that the water comes out on the other side. And all of you can see? I'm talking, I'm breathing. The whole thing is over, there are a few techniques. You blow your nose, try to blow the first one on the side, and the other one. And when you are really nice, you want to take a look at it, what came out. Oh my gosh, you don't want to see. Do it on one side. The mucosa in your nose, these are called like erectile tissue. Like when you are stressed, there is a swelling there. The mucosa swells up. What will happen initially when you want to do it, you are so scared, you're so afraid, no water will come out from the other side. Then what happens? You get more scared. So, oh my God, where is the water is going? Then when you're a physician, you know, oh, it's going to my son. Oh, you know, going to my cribriform plate, it's going to my brain, it's going to my frontal sinus. You know, knowing anatomy is worse, you know. Without knowing is better probably. So what will happen? You do the other side. Then as a physician, you will know how to get rid of the water from your sinuses and also from it even inside your brain. It will be okay. I'll show you how to do it. So now you're doing the opposite side. You put it in the nose, just put it in the nose, breathe through your mouth, turn your nose to the other side. Can you guys see how easily it is coming out? Same thing you do now, blow your nose. Next thing you do, you stand up a little bit, and now you blow your nose in different orders. First you come in the front, you blow your nose, do a Kapalbhati Pranayam type, blow from abdomen. Turn your head down, then do it. Turn your head to the other side. Turn your head to the other side. Then you have all the sinus, the frontal sinus, you do, take your hand in your brain in the frontal sinus. You do 1, 2, 3, 4, 5. All comes out. Now you do a minute of Kapalbhati Pranayam now. Now what you do, you breathe out, take a deep breath in. Oh my God, how do you feel? You are inhaling literally 3 times, 4 times more than your tidal volume. You breathe out, breathe in. Wow. I am not afraid of those 2 amoeba causing 2 amoebic meningitis in New Orleans out of 300 million people in the United States. Please keep on doing it. One question I always hear. Water. What water you need? Does it need to be sterile water? Does it need to be boiled water? To me, if it is drinkable water, it's fine. My nose, if you're careful about nose, if you want to put a sterile water, it's fine. Boil the water, put it in, it's great. If you go to a public swimming pool, if you go to a YMCA pool, when you dip, what happens? That all the water is going through your nose. That is the most unhygienic chlorinated water going inside your nose, and you survive. Nothing happens. Nose is the most resistant organ. Nothing will happen to you. Please do it daily. Sit down with the pranayama now. Sit down again with your spine straight. Siddhasan, Sukhasan, or a Padmasan. One best way to do a pranayama also is in a chair. If you sit down in a chair, If you sit down in a chair, you sit in a chair, start all the way to the back, keep your spine straight. This is the best to do pranayama. Second pranayama is sitting in a sthiram sukham asana. You are sthir, you are still, you are happy, and you are doing the pranayama. Third one is what happens when you're doing pranayama, your back causes a little bit of relaxation. When there's a relaxation in the back, you also feel a little bit of a discomfort. So many a time, you're better off supporting your back against a wall. If you sit down against a wall, supporting your back, I do it all the time in the morning. I will be putting myself back against a wall and I will do my pranayama practice. And that's the way we have given you the other one, we have given you all these yoga therapy for different disorders to keep it as your if you look at your handout, you will see it. I don't think you will have all the pictures there. The pictures are not there, but all the treatments are there. I'm going to get into the list of pranayamas where we are. Before the pranayama, what also you need to see that this is the one I was going to show it to you. You have it there in the picture. This is a fellow, he's a Russian guy. His name is Rinat. They have gone to the Himalayas. They've seen all the yogis. They sit down. They do called the Agni Kriya, and they sit down with their clothes on or clothes off when there is snowing outside. It increases the Agni inside, the fire. And this is primarily due to intense peripheral vasodilation. You get so much of parasympathetic activation, they get an opposite effect of normal cold. Normal cold causes a vasoconstriction. It closes the blood vessel, so it shuts all the blood to the inner part of the body to warm it up. Here it opens up. So between the outside and the body, there is a layer of blood which acts as a buffer so they don't feel the cold from outside. For all the pranayams, what you really also need, you need to have a hand strength. We have not done the asanas in the hand strength, but you will like to do the hand strength. And, before that, a lot of hand strength exercises are there. One is your Bakasana, the crane pose. You have a Mayurasana, which we practice all the time when we do our practice session. So the first practice will be your before all these things take place. First, you learn how to do your breathing effortlessly. So you'll be sitting down comfortably with the spine straight, eyes closed, touch your index finger and the thumb, and you have done breathing out, count of 3 in, count of 6 out. I feel so good now breathing in because, even what Abha was saying, in fact, even if I test it, but both sides of my nostril are still open. And when you test yourself, you'll say every 90 minutes, it shifts from one nostril to the another. First one, you learn how to hold your breath. What you will do, you will breathe out first. You will take a deep breath in and hold. Hold your breath and then you will drop your chin down, touch your chin down, touch your chest and count. And you count how long you can hold your breath, and then once you can count, you will do it 3 times. Second time, you see if you can do 1 count more than the Second time. Let's first breathe out first. Take a deep breath in. Hold your breath. And do a chin lock. Jalandhar Bandha. Keep on counting how long you can hold your breath and do it on your own and do it 3 times. If you keep on doing it, let me do the talking. The component of pranayam which helps you is first able to lower your respiratory rate, able to hold your breath longer and longer, and able to do alternate nostril breathing. Okay, next one will be your abdominal lock with an exhalation. The technique is you'll breathe out first. You'll take a deep breath in. Completely breathe out. Suck your stomach in and hold. Hold it as long as you can. You can incorporate a chin lock, drop your chin down. Then you also incorporate a pelvic lock, mulabad. Contract your pelvis and pull it up. So how long you can hold. Do it also 3 times. You can do 1 count more than the next time. Technique is breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in and hold. Drop your chin down, contract your floor of the pelvis, pull it up, and stay here as long as you can. Do it 3 times. This is also called a Bhajya Pranayam or Mahabad. This literally cleans your physical body. Once you keep on doing it, after a while, you'll be in such a state of mind, you'll be totally relaxed. You know, you put your finger there, you're all there, you put your body will totally relax. You'll have no tightness, nothing in your body will come from your pranayama. You can extend a little bit more before you do the other 2 pranayamas. Since we are doing it, it's called Agnisar Kriya. Agnisar Kriya is the one also ignites the Agni, the Jadhar Agni. In Agnisar Kriya, you will suck your stomach in, then you will be able to relax enough, able to move your abdominal organs with your abdominal wall. So what you will do, you will be breathing out first. You take a deep breath in. Completely breathe out. Suck your stomach and massage. My abdominal wall massages all the internal organs, but that is in breath holding and exhalation. I'm breathing out first. Taking a deep breath in. I'm completely breathing out. Move, but able to move your abdominal wall back and forth. Can you do it today? Probably not. Can you do it tomorrow? Yes, for sure. It's a question of practice. Bhastrika is the first pranayama you start, especially the person was telling me I have a traumatic brain injury, I have a PTSD, you have all the neuropsychiatric disorder, you first start with the Bhastrika Pranayam. Bhastrika Pranayam, as you can see here, it is your active inhalation and active exhalation. What does it mean? Normal breathing is your active inhalation, passive exhalation. What you're doing, you are stretching your lung, you are using your muscles of respiration, and then muscles of respiration relaxes, the diaphragm goes high up, whole lung is collapsing like a balloon and the air is coming out. You are not making any effort. So you don't learn how to breathe in, so you learn how to breathe out. So the first, when you are a rogi means you have a disease. You'll be doing active inhalation, active exhalation. What you will be doing? You'll continue until you have an effort. By the time you keep on practicing, you'll practice it like me, you'll be able to do it for a long, long time, but we really don't want you to do more than 3 to 5 minutes. The timing, pranayam is called a Bidhi method, samay, timing, which is like a prescription medication. We like you to do not to more than 3 to 5 minutes, but when you have a disease, you do it gently, like this. Next phase, when you got a little better in it, then you'll be, we call it like you become a nirogi. You control your disease. Now, Bhastrika is like a bellows. You fill it up with the air and you let go. So what you will do, you'll be doing the concept, the air, you are filling it up and blowing it up. Try that a little bit. Say, and when you become a yogi, you start doing, this is called your art of living. Who knows about art of living? It's called Sudarshan Kriya. Have you heard of Sudarshan Kriya? Sudarshan. Su means good. Darshan means looking. You become good looking. Sudarshan Kriya. Look at art of living. You need a little bit of tissue or a napkin because you will have some mucus comes out when you do pranayama. So there is a Kleenex box here, you pass it along, you can hold on to them, and we'll be doing it a little bit of a breathing now in a Bhastrika, and in sequence we'll be doing it. We will raise our hand up, we will breathe in and breathe out. We'll do phases. We'll do a very slow speed. We'll do about 15 times. Then we'll do a medium speed 15 times, rapid speed 15 times. That is one cycle. Then we'll continue second cycle, third cycle, fourth cycle, fifth cycle, 10th cycle. You let me when to stop. I'm not going to stop. If you tell me to stop, I'll stop. Now, we'll do 3 cycles, and you'll see with the 3 cycles how you feel. It has a tremendous effect on your cerebrovascular function. It causes cerebral vasoconstriction. It's a hyperventilation syndrome. So raise our hand high up and we'll breathe in. When you breathe out, we'll do yogic fist. We'll put a thumb inside and pull it down. Deep breath in. If your eyes closed, put your concentration on your breathing. Breathe in, breathe out. In a sequence called Ishwar, Ishwar, Ishwar. Then you go a little faster called Soham, Soham. Let's do 15 of this. Then you do a rapid split called Vishnu, Vishnu. Slow speed 15. Medium speed 15. Rapid speed 15. Slow speed 15. Medium speed 15. Rapid speed 15. You can keep on doing it if you feel no effort, but stopping around 5 minutes is a good time. Bhastrika Pranayam, this is the great way of Pranayam. If you want to start somebody, start with this. It will cause a little bit of altered sense of consciousness. You will be spinning, you will be doing like this. In a short time when you will be doing it, you really even don't know you are doing anything. Your mind totally takes over. It causes a little bit of cardiovascular effect because you know, when a person is dying, what happens? They stop breathing, then the heart stops, and the brain stops, all the cellular function stops. If you improve your breathing, improve your heart function, improve your brain function, improve your cellular function. Diabetes, beta cell is not working properly. By improving breathing, may you improve your cellular function. Other important thing here is, if you feel a sensation of dizziness, if you feel a sensation of little bit of numbness, little bit of spasm, these are entirely normal. These are called hyperventilation syndrome. Don't get scared or don't get uptight, but it happens to you. This takes you to completely opposite of our breathing. Normal breathing is active inhalation, passive exhalation. We have a balloon here in the abdomen, there's a diaphragm here, and there's a balloon here. Your awareness is to bring the belly button towards your spine and squeeze this balloon to empty the lung. Active exhalation, passive inhalation. You are not breathing in. You have no attention of breathing. What your attention is to squeeze this balloon. Put your hand, you will see, put one hand in your abdomen, other hand in front of your nose. You'll see abdomen squeezes, air comes out. If you want to see how much air comes out, listen to this one. Very gently, 1 per second. Like you to breathe until you get an effort. Ultimate timing is between 5 to 10 minutes. 10 minutes is good. Completely relax. And use your mudras. Touch your index finger and your thumb. Put it over your nose, with your knees. One per second. You keep on doing it and get a feel of it. And I'd like you to do this is for a daily practice at home. This is the most detoxifying pranayam. It removes all the toxins in your body. Take your index finger, bend your index finger down, put it in the thumb on the top. This is the Vayu Mudra. Put your hand like this and keep on doing the breathing, and the breathing technique will be again 1 per second like this. Keep on doing it, let me do the talking. You feel the effect of it. Touch your middle finger and thumb and switch your fingers and you will get all the mudras with the same pranayam. This is called your Shunya Mudra. This is for hearing. Again in the Shunya Mudra, you keep on doing your breathing cycle again. Finger again is the touching your ring finger and thumb. This is called Prithvi Mudra. This is for diabetes and obesity. And you keep on doing it. And let me tell you the benefit of all this pranayam. This pranayam, keep on doing it, is called Agni Pradhan Pranayam. It improves your digestive fire inside your stomach. We are what we digest, not what we eat. Unless you can digest our food, it does not become part of our body. We need the stovetop inside our stomach to ignite. This improves our digestion. You know, I was in Smithsonian, I gave the talk, last one was January 11th. After lunch, I got an announcement from the stage. Dr. Sarkar, will you come up to the podium and teach the whole audience a pranayam for digestion? They just had a large meal. So did a pranayam for digestion. This is one of the pranayamas. Change your finger to the little finger and thumb. This is called a Vayu Mudra. This is to control your bladder. It also controls your kidneys, controls your uterus, controls your prostate. Man with a prostate problem, you sit down like this, we do this pranayama, Kapalbhati pranayama, and again, see, it's a complete effortless. I'm not breathing in. The moment breathing out, it is automatically I'm breathing in between. The day I was born, nobody taught me how to breathe in. I took a deep breath in. I learned how to breathe out. I don't learn how to breathe in. Breathe in, see I'm doing it, I'm breathing in between. I don't have any idea even breathing. My idea is all here. I just put all my awareness attention here and it automatically takes place. I never leave home without doing it. If I don't have any time, I'll do 2 sets of sun salutation, I'll do 10 minutes of this pranayama. Kapal is the forehead, Vati is a shining. Literally says you are glowing. When you're doing yoga, something will happen to you. Looks like there is an aura around you. People will come and say, when did you get your plastic surgery done? Who was your plastic surgeon? Let me see the scar, what you have. You literally look younger. Literally looks like there is an aura around you. That's where the name came from. Kapalbhati, the forehead shining pranayama. It's a detoxifying pranayama. Touch your ring finger, little finger and thumb. This is called Shakti Mudra. This is the strength. You wake up in the morning, you're in strength, sit down like this, and then just sit down and keep on doing. So if you keep on doing it, I like you may not able to do it today, but your ultimate will be 5 to 10 minutes. Diabetes, people with diabetes, we want them to do about 15 minutes. People with cancer, very interesting concept. People with cancer, in yogic term, Ayurvedic term, there is, our body is made of tissues called Sapta Dhatu. Whatever we eat food, the food converts into 7 tissues. Remember one thing, I don't eat liver to make my liver. I eat the piece of bread. My body has an intelligence that converts the piece of bread into the tissue. The 7 tissues, they are called a Rasa Dhatu, Rakta Dhatu, Mamsa Dhatu, Meda Dhatu, Osti Dhatu, Sukra Manja Dhatu and Sukra Dhatu. The plasma, the food for converted to plasma, that converts into red blood cell, converts into muscle, converts into fatty tissue, then converts into bone, then converts into nervous tissue, then is your reproductive tissues, and finally become called ojas. Cancer is regarded called a Manda Agni in Sapta Dhatu. Your Agni, the fire inside fire is low on all the 7 tissues. This Kapalbhati Pranayam is a treatment for cancer in a patient after they have your usual and customary treatment. This is called secondary prevention. Let them do about 15 minutes, sometimes about half an hour of the Kapalbhati Pranayam. The testimonials we have, if you come to India, you come to a place called Haridwar, and if you can go to the website called Patanjali Yoga Pit, Swami Ramdev, you'll see testimonial after testimonials how much people have improved with their pranayama practice. For the mind, you do alternate nostril breathing. So you'll be using your right thumb. Right hand, using your right thumb, close your right nostril. You breathe in through your left nostril in. You close your left nostril with the same hand with the ring finger and the little finger and breathe out through your right nostril. Then you will be breathing in through your right nostril now. Close your right nostril with your right thumb and you will be breathing out through your left nostril. So breathe in through your left nostril in. Close your left nostril with ring finger and little finger and breathe out your right nostril. The battery died. Can you see if that you can get a battery for me? So breathe in through your one nostril, breathe out through your other nostril, and very gently, completely effortlessly keep on doing it. And I will tell you the benefit of this pranayama. The whole system is done. Okay, this comes. Okay. Okay, because they're completing. So you're doing alternate nostril breathing. Left nostril is controlled by your right brain. So left nostril is your cooling. Left nostril is called Chandra Nari, or a moon energy. So how easy it is to breathe in and out. Both of my nostrils is completely open, and this only happens after a nedipat. When you do nedipat, both the nostril is completely open. You feel that effort, coolness and calmness. I'd like you to continue completely your effortless, but if you can continue, we'll be doing between 5 to 10 minutes. That is your prescription. That is your target. That's what you want to get in. That's what you'll get the benefit out of. The alternate nostril breathing, right nostril is controlled by your left brain, and right nostril is called heating. It's called Suranari, sun energy. It is a balance between right and left side of your brain. It literally exercises both half of your brain. We are all naturalized. I'm right-handed. I'm using my left brain more than my right brain. This is very good to improve memory. It is very good for your neuropsychiatric disorders. First pranayama we recommend for people with high blood pressure. People with hypertension, we do alternate nostril breathing. This is the pranayama for pain, chronic pain. People with chronic pain will do alternate nostril breathing. People with chronic pain also does very well with your balancing poses. You know, when they're balancing, we do there a lot of people with fibromyalgia do the balancing poses. So alternate nostril breathing primarily exercises both half of your brain. It's a balancing pranayam. It is a pain controlling pranayam. It is a pranayam for all neuropsychiatric disorders. Left nostril breathing is called Chandra Vedi pranayam. That is moon energy stimulating pranayam. What you do, you will be closing your right nostril with the right thumb. You will breathe in through your left nostril. Then you can breathe out through your left nostril. Or what you can do, you will be breathing in through the left nostril. Then you breathe out through your right nostril. But instead of bringing to the right nostril, you will again breathe in through your left nostril. Breathing in will be all through your left nostril. If you are feeling hot, somebody is always feeling hot, or somebody has a pitta related disorder, you do a left nostril breathing. Left nostril breathing is your calming, cooling pranayam, Chandra Vedi pranayam. Right nostril breathing is called Surya Vedi pranayam. It's called a sun energy pranayam. What you do again, you close your left nostril with your ring finger, little finger, you breathe in through the right nostril. You close your right nostril, breathe out through your left nostril. Then instead of breathing in through the left nostril, again you breathe in through your right nostril. And breathe out through your left nostril. Breathe in through your right nostril. Breathe out through your left nostril. This is heating pranayam. A lot of people very cold all the time. They are tickling with your thermistor. At home, you know, if a two-person, one is cold, one is hot, they're always turning the thermistor. So instead of that, you say, honey, do this pranayam. You'll get balance. So alternate nostril breathing called Anulom Vilom pranayam. Left nostril is called Chandra Vedi pranayam. Right nostril Surya Vedi pranayam. Then you come your called Nadi Shuddhi pranayam. Nadi Shuddhi, now you incorporate your breath holding. You take your hand, drop your index finger and middle finger down. This is called your Krishna Mudra. Then you touch your little finger, ring finger and thumb. And you will be making a pinch to close your nostril. So you'll hold it over your nostril. You will close your right nostril. You breathe in through your left nostril at the count of 4 in. Then you'll hold your breath for a count of 16 with a chin lock. Then you breathe out through your right nostril with a count of 8 out. 1:4:2. Yes. In 1:4:2. We said you do it time just to show you 1 or 2 times. You'll do it at home. Then you increase. So here you close your right nostril with the thumb. You breathe in through your left nostril with the count of 4 in. Pinch your nostril here, hold it for a count of 16 with a chin lock. Breathe out through your right nostril with a count of 8 out. Breathe in through your right nostril with a count of 4 in. Hold your breath with a count of 16. Breathe out through your left nostril at a count of 8 out. This is one round of your pranayam, and then you continue. When you feel better a little bit, you do it about 10 times if you can, then you increase your inhalation. You do it 5 in, 20 holding, 10 out. Slowly and slowly increase. Generally I can go almost, 10 in, 40 holding, 20 out, but do according to your capability, you increase. Throughout the whole day you can do a pranayam, but only time we like you to do it in the morning. Only pranayam you want to do it really in an empty stomach is a Kapalbhati pranayam. This one you don't want to do in a full stomach. And full stomach basically we mean a big meal. A lot of people go, I have to have a cup of tea and a little toast, before. I said, please have it. It's not going to hurt you, a little bit of food in your stomach. But if you get a full meal, wait about 3 to 4 hours before you do your pranayama practice. And throughout the whole day. After lunch, especially happy after lunch, when you feel a little bit of sleepy, you do the alternate nostril breathing, or you do a little bit of a gentle Kapalbhati pranayama. You'll see, you will be getting refreshed and you'll be going to waking up. Brahmari pranayama. We all talk about pratyahara. Pratyahara is the control of your 5 senses. And then also remember all these pranayamas you are doing, alternate nostril breathing, we say we have a timing. That's what we gave you the timing. Timing is the maximum level. We give you prescription. Take this medication 500 milligrams or 1000 milligrams. That's to give the pranayama as a dose related. You need to continue pranayama for therapeutic benefit. In a Brahmari pranayama, you shut down all of your senses, because remember, all the senses are keeping you awake, alert, and then you create a vibration. A vibration like a sound of a bee, 2 vibrations cancels and really quiets down your mind. When you do it, you put it your finger over your ear, put your index finger in the forehead, then you close your eyes with the other 3 fingers, you will be breathing out, then breathe in and breathe out a sound of a bee. Let's do it about 3 times. Breathe out first. Take a deep breath in. to do it about 7 to 10 times when you do it at home. It is such a powerful pranayama, it literally takes over. You will get the effect of pranayama when you keep on doing it between 6 to 8 weeks. If you keep on doing it by 6 to 8 weeks, you will see it totally controls your whole organ and body function. This quiets down your mind to the point, this is the first pranayama we use for insomnia. If you cannot sleep at night, you do a little bit of pranayama, you will fall asleep. May not be tonight, may not be tomorrow. Within a short time, you will fall asleep. This is also pranayama. You see that it massages, the pituitary gland is just behind your angle of your nose. It literally, you can feel it. It completely controls your mind, and you have no idea. Even here, I don't know if you see it, you're all going in all different directions because you have no connection outside the world. Sitali and Sitkari pranayam is very good to cool down. Yes, brother.
The breathing, could you please tell me once more?
The Brahmari is that once you do it, all yogic tradition, you breathe out first. Then you take a deep breath in, and breathing out with the sound. Breathing out. And then when you are really becoming more proficient, then what you do, you change the pitches like a bumblebee. It goes in different, like it will be like here. Pranayama, unless you practice it, you have no idea what you are missing. Yoga is all about controlling your breathing and breath. We never breathe through your mouth, but keep us cool down inside, we breathe through our mouth. What you do in Sitali means cooling. We stick our tongue out, roll our tongue out, we breathe through your tongue in, close our mouth, then breathe out through your nose. So stick your tongue out, breathe in through open mouth, through rolled tongue. And breathe out through your nose. If you cannot stick your tongue out, you can put your teeth together and breathe through the teeth. You're breathing like this. Within a few breathing, you'll see your whole inside will cool down. Very good pranayam for women with hot flushes. Pranayam for people with acid reflux. Pranayam for people with a sore throat. Pranayam for people with high pitta disorder. People with heart disease, pitta related disorder. It's called Sitali pranayam and Sitkari pranayam. Resistive inhalation, resistive exhalation. We have seen resistive exhalation first. It's called Shankha pranayam, the conch shell blowing. What you do, we take our hands, we do a yogic fist. We put the thumb in, put the yogic fist, we put one in the top. Then what we'll do, we'll be breathing in through your nose, breathe out through your mouth as long as we can, and in the back, if Mita is there, she can blow the conch shell to see how this is exactly what they were doing, blowing conch shell. Let's breathe in through your nose, and breathe out, let's blow the conch shell. Keep on doing it 3 times. Breathe in. This is it. Okay, now, if any of you want to try the blowing the conch shell, you'll see how difficult it is. It is a very difficult job. You won't be able to blow the conch shell. It takes a long practice. I don't know how long these women are practicing, but again, it's a practice. They've been practicing, they can do it. We have people, like I have a person who's a saxophonist, he goes in and he starts blowing out, man, he's gone, almost minute and a half, 2 minutes, because he has a practice, about that. All the great pranayam is your Ujjayi pranayam. Ujjayi pranayam is the hallmark of pranayam. Ujjayi means victorious. You have overcome all the breathing techniques now. So what you do, you will be first gently, you'll be breathing in and out through a closed windpipe. Like you'll be breathing like this. This is your dark Veda breathing, and I'll tell you the benefit of this breathing. This is your breathing in and out through a narrow breathing tube. And once you have a control on that, you progress, you close the larynx, try to breathe in. Say to me sometimes, it is called a show off pranayam, isn't it? You have to show off sometime. Is it okay to show off sometime? Yeah, he said yeah, No, this will come to you. This is the most difficult of pranayama, but try gently first. You'll see this will go in. If you get a cough, it's entirely normal. Cough comes from there. You learn how to close. See what you're trying to expand your chest. You're getting a power. You get a big, powerful effect. It massages your thyroid gland. Very good for your thyroid gland. Ujjayi pranayam is very important. What it does, there is two nerves in the larynx called superior and inferior laryngeal nerve. They're primarily called a vagus nerve. All the parasympathetic activation, what you're talking about, is through the vagus nerve. Vagus nerve is called 80% called afferent. Afferent means the signal goes to your brain. So the brain goes signal, it goes to area which is very close to other called cranial nerves. One is called glossopharyngeal nerve or hypoglossal nerve, 9th and 12th nerve. The glossopharyngeal nerve contracts the muscles in the soft palate. So it tightens up the soft palate. So what it affects it is basically it controls your snoring. When you have a sleep apnea, snoring, you practice Ujjayi pranayam. This is a very powerful pranayam for snoring and sleep apnea. It also very effective for sleep apnea because in the sleep apnea, the tongue falls back. It also stimulates the 12th nerve called a hypoglossal nerve. When hypoglossal nerve contracts, the tongue pushes out. So the tongue pushes out, it creates a sense of not having that choking feeling, not having the sleep apnea. So very good for snoring, sleep apnea, thyroid. People with a thyroid problem, people with thyroid, I give you all the list, what to do thyroid, your shoulder stand, plow, Ujjayi pranayam, most of it. Camel pose, very powerful for your thyroid disease. We have so many people. We have a very interesting story. The lady, she had taken a thyroid pill, and she came to the doctor. She said, "I'm feeling warm. I really feel hot." So she said, it might be my hot flushes. So it's going on for hot flushes for a while, but after a while she came back. Her thyroid level was way, way high up. She was doing the pranayama, she was doing the yoga practice, and basically she did not need the thyroid supplement. So the thyroid medication was making her hyperthyroid. That's what she's feeling hot. She's here, she's actually a physical therapist. She tells the story to everybody. So there's a lot of other pranayamas which I'll give it to you in the list, called Mursha pranayam, Plavani pranayam, but again, all these pranayamas, you need to learn how to put it together just like a daily practice. For a daily practice, what you really need to know now, you need to do is a set of relaxation techniques. You'll be able to sit down in a sthiram sukham asana. Very still, very happy, spine straight, eyes closed, with a mudra, and able to breathe out longer than you're breathing in, and able to do the poses or asanas completely effortlessly in stages. You do not want to get into any kind of alignment. You really want to get into using the asanas in stages to use it as a therapeutic tool. And believe me or not, we have so many people here, including myself. I don't know if you know my story. I had open heart surgery 13 years back. And today, only thing I do the daily practice of yoga practice in the morning. I take no medication. I still do the medical checkup. I still go to see my doctors every year. It's a good part, which I'll continue. But again, I knew exactly what caused my heart disease. I know exactly how to overcome it, and I enjoy it. My cardiologist says something will happen to you. I said, what will happen to me? I'll drop dead. I say, I want to drop dead, especially I'm teaching yoga, I have to die someday. Then there will be front page of the newspaper, yoga kills, So, great news from William Broad, Have you read the book? The Yoga Injuries, Science of Yoga, from the book. Okay, we have a lot of materials we are here, but basically we have a primary here for practice. That I said, we like to practice for the whole day if we can. So it's a very comfortable, relaxing practice. Any questions, what you have? Yes, ma'am.
Could you give a 45-minute daily routine?
45 minutes daily routine. The first and foremost daily routine is your keeping your spine straight, eyes closed, with your Dhyana Mudra, and able to breathe. And then it will come, the first one will be your spinal flexibility. Keep your spine straight. Generally what we do, we say, you sit down, able to sit down in a squatting pose, and able to get up without any support. When you get up, you use the balancing poses first. Balancing poses will consist of able to stand on one foot and able to do it with your eyes closed. Then you will be doing spinal flexibility, forward bend and backward bend with support. Don't do unsupported forward bend, unsupported back bend. Best way of support is your Paschim Namaskar. You can put your hands in the back in a prayer pose that keeps your spine supported. You will do the spine, flexibility of the spine. Also, in the meantime, you will do a little bit of called it a Shukho the light exercises, the hand, elbows, shoulders, very gently for a very short period of time. It generally takes less than 5 minutes, 3 to 5 minutes is maximum. You will do standing poses, balancing poses, and flexibility. Then you will sit down, and sit down poses, the primarily you do for a daily practice is a Mundukasana. Mundukasana is for a daily practice, and a Vakrasana. Vakrasana is your spinal twist. Those you like to do it. Then alternative days you do the Marjarasana, the cat pose, and Ustrasana, the camel pose, in sitting down poses. Then you also incorporate a little bit of Gomukhasana, the cow face, and the Shashanka Asana. These are all in your list. You alternate, the best thing is to alternate so that you'll be able to do it in 45 minutes. Then it will be your face down. Face down, you do 3 asanas. You do first is called Markadasana, crocodile. Get your, like a TV viewing pose. Then you go to Bhujangasana, then is Salavasana. Then you're laying down, you do primarily 2 poses, your Pavan Muktasana, knee chest, and your Markadasana, the spinal twist. Hands on both sides, spine on both sides, and then you can incorporate some inversion, especially shoulder stand, plow, and headstand. And this will really, if you really want to do it in sequence, you will see you can able to do it in 25 minutes to half an hour. Then we'll do a pranayama, primarily 3 basic pranayamas. It is called Pradhan Pranayam. The first is a Bastrika, the active inhalation, active exhalation between 3 to 5 minutes. That is called your Vayu Pradhan Pranayam. It's called a Prano Pradhan Pranayam. Prana, it brings our, Pradhan means main. It brings the life force, prana, in our body. Next one, you will do a Kapalbhati Pranayam. This one we like to do between at least to start 5 minutes to 10 minutes. That is called Agni Pradhan Pranayam. It ignites the fire inside us called a Jathar Agni. Then the third one is the alternate nostril breathing, called your Anulom Vilom Pranayam, that is also between 5 to 10 minutes. If you do 3 basic pranayamas for a daily practice, it's very good. Then you incorporate the Bhramri Pranayam, that is between 7 to 10 times. Then you bring a little bit of Ujjayi Pranayam and a Shankha Pranayam. You'll see that also you can do within 25 minutes. And then you can do a 10 minutes of little meditation and pranayam. A meditation will come about an hour, and once you shrink it down, you'll see you can easily do it in a 45 minutes. What you like to do, to take a asana and stay there a little longer and longer and longer. I said people do 25 asanas, 25 asanas, oh I can do 10 of them, it's great, beautiful. Short time you say, no, now I'm doing only 8. I said, why? Because I stay there in the asanas for a longer time. So again, able to do sitting down poses, able to get up with unsupported, balancing poses, spinal flexibility, standing up, then sitting down, especially spinal twist, all yogas is all about spine. The flexibility of the spine is your life. Rigidity of the spine is death. Final rigidity is called rigor mortis. You heard the word called rigor mortis? Before getting inside the 6-foot box, you get rigid enough. Okay, anything else? Before we go our next phase, we'll do a little meditation, quieting down our mind.
Osteoporosis.
Osteoporosis.
That, like forward bends weren't really so good for osteoporosis.
Okay, osteoporosis, anything you do for osteoporosis especially is not good for your asana practices, especially unsupported. First and foremost to do alternate nostril breathing. The reason is alternate nostril breathing for osteoporosis is not due to lack of calcium. How many people here takes calcium? All right. So you don't know what the calcium is doing to your body. You are not deficient in calcium. Bone has two cells. One is called an osteoblast and called an osteoclast. Osteoblast deposits calcium in the bone and osteoclast removes the calcium from the bone. Osteoclast is stimulated by stress hormones. All the cortisol stress hormone stimulates osteoclast. By the time the osteoclast is stimulated, calcium sips out. This is basically a sipping of calcium coming out of your bone. If you have a bone scan, it shows osteoporosis. If you take calcium by mouth, then you repeat the bone scan will never change. Only time bone scan will change if you take the medication which paralyzes osteoclast. All the medications you see, I don't remember all the names, Prolia, what's it called, Boniva, Fosamax, they all act on the other side. They act paralyzing the osteoclast, so calcium cannot come out. If you take the Fosamax, you will see bone scan gets better, no question about it. But those medications have a tremendous side effects. So best thing is to say, we need to bring a balance between osteoblast and osteoclast. We recommend alternate nostril breathing, and when you do the asana practice, you do it with your awareness that you don't have any pain, you have an effortless breathing, and you have a supported, bend, forward bend or backward bend.
Will your bone scans get better then?
We really don't know yet, but most of the people really do well, and there is a tremendous amount of slogan for anti-calcium now, because there is a tremendous movement for women not to take calcium, especially ionic calcium, because ionic calcium, when you're taking it,
What kind?
the calcium what you take, that calcium generally goes into the blood, and the biggest danger of our blood vessels is calcified blood vessels. All the calcium goes to blood vessels, causing the atherosclerotic plaque. So there is no winning. Only winning is do yoga every day. Vertigo is a very powerful tool. Vertigo, I really have a lady with the vertigo. She cannot even drive, she couldn't do anything. Alternate nostril breathing. Alternate nostril breathing, literally. In fact, this is so interesting. She's a physician. I taught her all the pranayamas. I tell her to all the pranayamas. I do the balancing poses. Let her hold on a wall or a chair and stand on one foot. Do the balancing poses. And after a while she came, she says, what really helped me was alternate nostril breathing. Alternate nostril breathing is a treatment of vertigo because it balances your brain, and the balancing poses. Learn balancing poses, very, very important. Yes?
Can we do yoga at night before going to bed?
Very much, but especially, if you try to do this, try to do it a little empty stomach. If you do it, if you do an early dinner, if you get it 2, 3, or 4 hours, 3-4 hours is very good. Nighttime is fine. Best time is the morning, early in the morning if you can. One thing I'll tell you, one thing will happen to you. Initially you find time for yoga, then yoga will make time for you. Okay, what else? Yes?
Tinnitus.
Tinnitus is the Brahmari Pranayam. When you do the Brahmari Pranayam they were doing, it is basically, it counteracts the sound you have inside the ear. In fact, based on that, tinnitus treatment is an external, there is a device now which creates the frequency to counteract the frequency of tinnitus. So do the Brahmari Pranayam for tinnitus. See, we are holistic, but now we're getting reductionists now, come to the point, but it works. What else? Okay, if not, you lay down, go to the mat now. We'll go ahead and do a little bit of meditation, and then we'll finish up a meditation. Meditation is a phenomena which will quiet down your body and mind enough. So lay down in the mat, be comfortable, hands on both sides, Palm facing high up. Separate your feet a little bit. And pay attention to your breath. It is all about breath-centered meditation. Visualize your breath. Visualize your breath coming in through your nose. Then bring your awareness to your nose. Awareness to the air which is coming in. Have the awareness of the quality of that air. If the air is warm, if the air is cold. When the air is coming in, bringing awareness to see how fast it is coming in or how slow it is coming in. Then visualize that breath coming in through your nose. It is going behind your throat. It is going down to the chest and coming at the level of your belly button. At the level of the belly button, the breath stops. You make a little pause, then visualize the breath coming out. The breath is coming out through your abdomen, coming out through your chest, coming out behind your throat, and coming out through your nose. Visualize that breath holds just a little outside your nose. Slowly and slowly you will see that the timing of the breath holding at the level of the belly button, at the level just outside the nose, increasing in timing. Once it increases the timing, it becomes called a kumbhak. Kumbhak is the breath holding. And slowly, it becomes like a cable kumbhak. You have no idea that you're even breathing. Your mind drifts into slowly in a state called your dream state. State of our mind first is the awake. It's called Jagrata. Then it's called a dream, Shapna. Then it's called a sleep. It's called Supta. Then the fourth stage is called Turiya. It's a blissful state. Slowly you get into those four states. There is a light-centered meditation. You visualize a colored light is coming through your breath. Blue color light is coming through your breath, is coming inside your body. It is scrubbing, cleansing all the toxins in your body. Then out breath is removing all the toxins in your body. You breathe in all the positive emotion, breathe out all the negative emotions. Breathe out all the toxins within you. All the diseases you have, they emit a volatile substance. They come out through your out breath. We can diagnose large number of diseases by analyzing the out-breath air called exhaled air. Slowly and slowly you relax your whole body. Relax your toes, relax your feet, relax your thighs. When the part of the body is relaxed, you feel like that does not even belong to you. You can start relaxing your hip areas, relax your chest, relax your head and neck. Head and neck is the area where you are holding all the stress within you. Try to relax your tongue, relax your jaws, relax your forehead muscles. All the tensions you have been within you have to let go. You are relaxing your physical body and mind. You are able to breathe completely effortlessly. Now you have to let go. Let go of the tension you have been holding within you. So you transcend your body. Transcend your body from a gross body to a subtle body. Subtle body goes to a causal body. We have 5 layers around us. First, we are made of food layer, food sheet, called Annamaya Kosha. Around that is our breath, Pranamaya Kosha. Around that is our mind, Manomaya Kosha. Around that is our intellect, called Vijnanamaya Kosha. Finally is our bliss, called Anandamaya Kosha. When all are get balanced, you are healthy, you are disease-free. At the level of your 5th layer, Anandamaya Kosha, or a blissful state, you are in balance. Body, mind and spirit is in balance. At the level of your rationality, imbalance starts to set in. But your rationality pulls you back. At the level of your mind, all the imbalance starts. The root cause of disease is at the level of mind. When the mind is in imbalance, it shows up in your breath. Your breath becomes erratic. If your breath is not effortless or breath is not completely in sync with your mind, you develop disease. When your breath is in imbalance, it shows up in your body. So when the disease shows up as a diabetes, hypertension, or heart disease, it's already too late. Then we treat our physical body with a medication and procedure that is like a symptomatic treatment. With yoga, we control our mind. We get to the root cause of the disease and we cure all the diseases. Learn how to control your 5 senses. The controlling your 5 senses will cure all the diseases. Dharan, the concentration, is the 6th limb. In concentration, you have your increasing thought process. But when your thought process increases, at a certain point, you get sort of like a defocused. The number of thoughts starts to come down. You enter into the 7th limb, is called meditation. People ask, what is meditation? Meditation is a practice of the 8 limbs of yoga. And after the 6th limb, the 7th limb is meditation. Yoga also tell us that we have 7 chakras. Chakras are in our subtle body. Subtle body is the one when you close your eyes, when you concentrate on your mind, you find your subtle body. If you close your eyes, you can visualize your body is in front of your house. You can open the door, you can getting inside the foyer, getting inside all the rooms. That is your subtle body. The chakras are wheels. It's an energy centers, and you need to open up those wheels and awaken the chakras. Called chakra awakening meditation. The sounds which will wake up the chakras. This is called your Kebal Kumbhak, empty bowl meditation. I gave it to you on your handout. You will have it, practice it at home, and slowly and slowly just move your toes, move your fingers, put your both the feet together, turn on one side, bend your knees, put your head on the folded hand, and you get up and sit down in a cross-legged position. We'll practice chakra awakening meditation. In a chakra awakening meditation, what you'll do, you'll begin sitting down in a Sukhasana, Siddhasana, or a Padmasana. You'll keep your spine straight. You touch your index finger and a thumb like a Dhyana Mudra. Close your eyes and bring your awareness along the whole line of the spine. Chakras have a color. The colors are in the same sequence as the color of the rainbows. Vibgyo, violet, indigo, blue, green, yellow, orange, red. It has the petals. It is like a wheel. The first one is a root chakra, Muladhara chakra. It is red in color. Visualize a red color. It has 4 petals. It is at the root of the spine, and the sound to awaken is a lum, L like in Larry. So breathe out first. Take a deep breath in. Lum. Second chakra is a pelvic chakra between your belly button and the root of the spine. Color is orange. It has 6 petals. And a sound to awaken is Vam, V like a victory. So breathe out first. Take a deep breath in. Vam. Visualize the third chakra is at the level of your belly button. Manipur chakra, solar plexus chakra. Color is yellow. It has 10 petals. The sound to awaken is rum, or like a rubber. Breathe out first. Take a deep breath in. Rum. Fourth chakra is Anahata chakra, level of your heart. Color is green. It has 12 petals, and the sound to awaken is yum, Y like yellow. Breathe out first. Take a deep breath in. Yum. Fifth chakra is Vishuddha chakra at the level of your throat. Its color is blue. It has 16 petals. Sound to awaken is hum, H like in head. So breathe out first again. Take a deep breath in. Hum. Sixth chakra is a third eye chakra between your eyebrows. Color is indigo. It has 2 petals, and the sound to awaken here is called sham, S-H. You breathe out first. Take a deep breath in. Sham. Seventh chakra, the Sahasra chakra, level of your crown. Its color is violet, 1000 petal. Sound to awaken is Om. So breathe out first. Take a deep breath in. Om. Slowly open your eyes, rub your hands together. Just get very good yogic posture again. And once it is nice and warm, you feel the heat, in your hands. Put it over your eyes, cup it to your eyes, massage your forehead, massage your eyes. We'll be finishing with Simhasan and Hasasan. We'll let go. We'll be roaring like a lion, and we'll be laughing as much as you possible. You laugh as much as you can. Laughing is not fake. Laughing is contagious. When you keep on laughing, you increase your endorphin. So before we finish, is there any more questions you have, what you have done? You have that whole handout with you. Use it for your teaching purposes if you're a teacher. Use it for your practice. Or keep it under your pillow. Maybe there is some osmosis. The osmosis is good. Some knowledge will come when you're sleeping. And call me if you have any problem. Any health issue you want to talk about, what we need to do, hypertension, heart disease, diabetes, I give you everything in that handout. You practice it, probably we'll do another, maybe next year we'll do a retreat yoga for various diseases, will extend. Maybe that will give you a lot more timing for you to do it for the diseases. If not, I know many of you have done it, we'll do a Singhasana. The Singhasana, you will be sitting down first in a Vajrasana if you can. Then you'll be putting your hands in front, you'll stick your tongue out, roll your eyes high up, and roar like a lion. We'll do it about 5 times. This is all about the tension getting out from your body. You don't need any tension. Put your hands in front like this, then we'll keep on laughing. As much loud laugh we can do. So what you do here first, you stick your tongue out, get your eyes up, I cannot keep on stopping, when it does. Thank you again for coming, spending the whole day. I hope it will make a transformation. All of you, which happened to all of us, we are here, all the sign of transformation sitting in front of you, and wish you good luck. Namaste. Thank you.
Yeah, and I took the medicine before, but I stopped taking it, and I'm scared to take it, because like before I just took it, but now like I'm reading about it, yeah, if I want to.
My wife's friend there and acts as a voice in my life.
We actually had to take questions about the
When the osteo
arthritis. Because I have that. It wanted me to take Fosamax, and I took it for a number of years.